The United Nations in South Africa is mobilizing resources and rallying behind efforts to overcome their cholera outbreak in Hammanskraal, north of Pretoria. So far, 21 people, including children, have died due to the preventable diarrhea disease, with 77 confirmed cases registered so far. Now, Toby Fricker is with UNICEF, and he was in Hammanskraal today and joins us now live. Toby, thank you for making time for us this afternoon. You were in Hammanskraal yourself today. What did you see? Are things bad?
Yeah, that's right. We were in Hammanskraal and also particularly in the Kanana area of Hammanskraal. We were really working on what is the most vital thing, which is prevention. And that's absolutely critical now. We have this outbreak. So, for example, in Kanana, we were putting up triage centres, working with partners there, working with the local ward councillor, with others, to establish a triage centre which is in the community. And that links to maybe the key message now for people who are affected is to seek care as quickly as possible. Because what we're seeing, and what I was told at the Jubilee District Hospital, was that the dehydration sets in so quickly. So the nurse was talking about how people had come in and she had seen similar cases, but not where dehydration really hit in so fast and affected them so quickly. So we met also 3 children in the clinic who thankfully are recovering. But what Tebiso, for example, 12-year-old Tebiso told me about how he just wants to play football again and get out of the hospital, of course. So really it speaks to what we need to do, which is about prevention. It's the UN in South Africa are working together. We're working closely with the World Health Organization to help to improve surveillance, data, situation reports, but also to get information to the community. And that's both through digital channels, but also in person, working with community health workers and others on the ground.
Mm-hmm. What resources is the United Nations mobilizing to help overcome this outbreak?
Yeah, well, we all have our own agencies, and we work through donors who provide support. We have core resources which we can pull in emergency situations. And so I think it's also important to mention that since February, when the first case came in Gauteng, we've been deploying, WHO have technical experts on the ground supporting the National Department of Health, supporting the provincial health departments as well. And then we're also using our own platforms, our own channels to get that critical information out to communities. So UNICEF, for example, works with community radio stations in different areas. We also have what is called a Europort platform, which has 230,000 registered young users, where we can actually put out messaging. So we can put out cholera prevention messaging and how to stay safer as well, and get that out as quickly as possible.
Yeah. Your efforts as UNICEF, I should say, started in February already, when the first case of cholera was identified. Did you think then that things would escalate so quickly?
I don't think anyone thought that the outbreak would escalate as it has. I think that's true. I think, however, what we have seen this year, particularly in 2023, is a number of outbreaks across the Southern Africa region and globally, more broadly. So there are 25 confirmed cholera outbreaks globally, and that's way higher than we've seen for a long time. So in some ways, it's all about preparedness, being prepared to act in a situation like this that we're seeing now. And COVID, we learned that also through COVID, working with communities, particularly on the ground, to strengthen messaging on how to protect yourself better from the virus, but also then hand washing and other water sanitation messaging as well to the communities. So that's something we learned, but it's really all about preparedness. But this outbreak has certainly escalated quickly.
Yeah, and you've mentioned the importance of messaging. So I imagine the awareness campaigns are going to help a great deal, right? It will help educating communities about cholera and how to prevent it, the hygiene measures, etc. Has that work already started?
Yes, that work has started already, and the response team today in Kanana were telling us about the outbreak response teams who are starting to go door to door in the area to give out messaging about how to better keep your food safe, how to better store water, to make sure you boil water, for example. So that work's going on. The work also online is going on to reach communities who are digitally active, to make sure that we can sort of penetrate the messaging through online platforms to e-devices, to other platforms as well. So that's going on very much so. And the idea now, and what we're trying to do now, the UN in South Africa more broadly, is to really scale that up, essentially, and to make sure we get that messaging, particularly in areas affected in Gauteng, but also in Free State and other areas, to really be ahead of the curve.
Yeah. And from the resources that you saw today when you were in Hammanskraal, because our government has set up a command center of sorts to respond to this outbreak. Do we have sufficient resources not only to respond, but to contain this outbreak in that area?
Yeah, that's right. There's a lot of work going on in Hammanskraal, of course, in the Jubilee District Hospital, but also in Kanana. And what was happening today was setting up of a triage center, so putting up the tents, bringing in equipment to be able to treat people very quickly on the ground in the community. And then, of course, if there are more serious cases, they can be referred to the hospitals. So we are trying to understand where we can come in, what support is needed in terms of hygiene kits, in terms of storing water in a safe way in the triage center, which is a very specific approach. So providing that technical expertise with the World Health Organization and other partners who are there today to make sure it's set up in a way where prevention is really number one and saving lives is the key thing.
Okay. And let's talk about some lessons. What do you think are lessons that all of us can take from this crisis? Obviously, hindsight, it always helps us to look back and reflect on how we can do things better next time.
Yeah, absolutely. I mean, I think the first lesson, and for anyone, it's really a call more than a lesson, I would say, is to seek the care that you need quickly. We may think, oh, it's just another, I just got a bug, a stomach bug, but it could be more serious. So it's taking that seriously in the first place, because that delay can really then affect someone's life. And that's number one. And I think then also what's absolutely key is that we take into account the water sanitation and how we improve that, of course, at a community level, but also how household level can make sure that they store water safely, they cook safely, and they understand how to really approach it from a holistic point of view. And that goes to schools as well. So we've been working in schools with children, with teachers, doing hygiene sessions, for example, and that started, of course, through COVID as well. So it's part education, it's part response around water and sanitation in particular, but it's also very much about prevention.
Okay. Toby Fricker, thank you so much for making time for us.